Murphy and professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
So people trying to find COVID tests all across the country, they're very hard to come by. What's going on?
People are testing like crazy. We've been telling everybody, if you're going to meet in a group, go get tested. You're going to go fly in an airplane someplace, or you're in quarantine, you have to get tested at day 5. Guess what? We don't have enough tests. The good news is that that is going to improve soon, but not soon enough for many.
Let's talk about Omicron for a second here. In terms of adults who are vaccinated and boosted, it seems like hospitalizations are not, obviously not surging. But for kids, what is going on? And we just talked about it, but I was curious what your thoughts are on it. Is it because children aren't vaccinated for most part, not fully vaccinated?
Yeah, Lauren, well, it's disturbing. Yeah. There's 800 kids a day being admitted to hospital. Over 2,000 are in the hospital right now. They don't necessarily stay in for a very long period of time. And it's being reported worldwide. It's reported in the UK, reported in South Africa, and even here with all these cases going in. We don't really know if it's because just they're unvaccinated, or this Omicron is affecting kids more than the other variants. We can't answer that question yet, but it's they're coming in the hospital more.
Israel doing tests here on a 4th booster shot here. Is that possibly coming to the United States?
Well, the Israelis are ahead of us for a good reason. They started the whole vaccination process earlier and got more people vaccinated early. So they're a sentinel group out there. So what they're seeing is actually a difference in breakthrough cases depending on which vaccine you got. And they're showing that after that 3rd dose, the booster, what we're calling the booster dose, the efficacy of the Pfizer drops from about 70% to 45%. If you got a Moderna vaccine, it looks like it stays at about that 70%. And we're only talking, this has just come around. So it's 9 to 10 weeks is as long as anybody's been looking at this. So it's disturbing. So they're looking at a 4th dose, and they're starting with a study with healthcare workers because they're getting so exposed.
Dr. Murphy, we saw 50,000 cases in one day in New York City. Should we be looking at, what some health experts are suggesting, looking at not cases, but hospitalizations instead?
Well, the cases are just astronomical.
Yeah.
And this thing is, Omicron is just breaking through. What we need is a version 2 of the vaccine. So all the vaccine companies that have been commented on this have said they're working on a version 2. But that's going to take many months. So it really depends what happens in the next couple months. Then we'll get a better version of the vaccine, most likely. And remember, the vaccines, when they originally came out, they were over 90% effective, the mRNA vaccines.
All right, let's get to some questions here. This one's particularly important here, considering the lack of tests out there. This person asks, without taking a test, is there any way to tell if you have a cold or COVID-19?
Yeah, no, unfortunately, no, especially with the Omicron. Omicron is behaving more like an upper respiratory tract infection, like the other human coronaviruses. There's 4 of them, and you cannot tell. Just a runny nose, a sore throat, that can be COVID. The one thing that stuck out before was the loss of taste or smell, and that is much more associated with COVID.
Question. A friend of mine teaches in a school that is kept at 75 degrees. I keep a cool classroom and we've been relatively okay, whereas my friend's school is having a startling increase in cases. Does temperature in the building make a difference?
Probably not temperature, but the heating and ventilation system, the blowing of air, how much ventilation there is, that's much more likely to be the cause here, or it's just they got bad luck. They got a lot more kids infected. So, heat doesn't really have much to do with it. We've had huge outbreaks in Florida and Texas and Africa. So it's not heat, it's ventilation.
Okay, one more question here. Will the need to quarantine go away soon since the Omicron variant seems to be everywhere?
Yeah, this is actually a very good question. And I've been hearing this lately. However, if we just give up on quarantining now and even isolating people that are infected if they don't have symptoms, the whole medical system is going to implode because right now we're pretty close to the maximum that the hospitals can handle reasonably well. If it gets any worse than this, in other words, if we speed up the infection rate by stopping quarantining and stuff, quarantine works, by the way. It depends how hard you are with the quarantine. But if we stop quarantining now, you're going to have a medical crisis way beyond what we've ever seen.
Switching gears for a second here, Dr. Murphy. Nancy Sinatra tweeted out your quotes from a Washington Post article last week.
Didn't know if you were aware of that. Did you know she?
No, I've heard this a couple times.
See?
Yeah.
Even the celebrities getting involved here.
All right, you're going national and international, Dr. Rob Murphy. Thank you.
She's spreading the good word.
Yeah.
All right. Well, if you didn't get your question answered, Dr. Murphy answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or head to our Morning News Facebook page. You can post them there. Dr. Murphy, thanks again. We really
Thanks,
appreciate
Dr.
it.
Murphy.
Okay, see you Friday.
Sounds good.